spending 25% in 1 year. Even I, a Texan, can figure out how long it's going to take us to double government spending at that rate. It's going to take us 3 years to double the discretionary non-security domestic spending of the government. Oh, and then we got debt. Something happened to him on the way to the White House. The debt that would run 2% of GDP didn't turn out to be so bad after all, because he comes into office and proposes a budget resolution led by Spratt, who works to get it through, which calls for doubling the size of the national debt in 5 years and nearly tripling it in 10 by running deficits that run 5.1% of GDP. If he has his way, we will have a debt at the end of 10 years that will be in relationship to the GDP as bad as it was in the end of World War II. About 135% of GDP. We'll look like Greece on steroids. There was a reason after the budget resolution was passed that Moody's came out and said U.S. Treasuries may not always be the best, #1 top rating in the world. A warning they reiterated 2 weeks before the health care bill was passed. Barack Obama will run up in the first 20 months and 11 days of his, in those 8 years when Bush was in office, the economy grew from $9.7 trillion in size per year to $14.2 trillion in size. It nearly increased by 50%. The $4.5 trillion in additional growth in the American economy annually by the end of Bush's time in office is equal to the entire size of the Japanese economy. That's how powerful the engine of growth was. We had 52 months of consecutive job growth. Oh, the Democrats kept running down the economy, they kept running down the performance, but how do they like it now? And then we got health care. #1 issue facing America, jobs. #2 issue facing America, jobs. #3 issue facing America, jobs. So what does the Obama administration focus on? What does the president go out and give 58 speeches over 51 weeks, including 2 nationally televised addresses to the country? Health care. Now why? 83% of Americans have health care coverage, and by and large, they're happy with it. 91% of people think they do have coverage. I'm a little bit worried about the 8% who think they have coverage who don't. Honey, don't worry, we're covered. But the vast majority of the over 300 million Americans like what they got. Oh, well, we were told, you know what? We got 46 or 47 million uninsured in America. That's a scary number. That's a big number. But what is that number? What is it made up of? I went to the Census Bureau report. 9.7 million of that 46 or 47 million are legal or illegal aliens inside the United States. Now, I'm pro-immigration, but I do not think the American taxpayer ought to be picking up the tab for people who are here illegally for their health care or people who are here even with a green card or a visa. We just shouldn't. We got 18 million people. We got 18 million people out of that number who make $50,000 or more a year. They tend to be young. They tend to think they're bulletproof. They tend to be self-employed. But you know what? If you're making $50 or $60 or $70 or $80,000 a year, you can afford some kind of health coverage. You can even get a bare bones catastrophic policy. And while I wish those people were insured, and I bet if they get sick or have an accident, I bet they wish they were insured. We are still a nation of individual responsibility and personal liberty, and it is not up to the government to tell us what to do. This bill would establish for the first time ever that Americans would have to buy something as a condition of being alive. Then we got, out of that number, we got 14 million people who are already eligible for some kind of government health assistance. They're eligible for Medicare or Medicaid or TRICARE or CHAMPUS or VA or Indian health care or some kind of government-provided health care assistance. And guess what? The government has done a lousy job of signing them up. It's got all these programs, and those programs can't seem to sign these people up. So let me get this straight. We're going to create another government program in order to do what all those existing government programs can't do, and that is get these people signed up. Why don't we just focus on the programs that we've got and get them focused on doing the job we set them up to do? rather than creating something that's going to discombobulate everybody. Oh, and then we got, we do have a problem. I admit it. We got 46 or 47, minus 10, minus 18, minus 14 leaves you somewhere in the vicinity of 5 or 6. And I do not want to underestimate or diminish the problem that's faced by those 5 or 6 million Americans. First of all, they're working, but they don't get coverage from their employer who can't afford it, and they make too much to fall into Medicaid. But rather than sort of discombobulating all 300 million Americans, why don't we focus on a solution that helps, or solutions that help make health insurance coverage more affordable and accessible to those people? Why don't we define the problem and then work the problem rather than sort of throwing out this big cause and sort of ripping up everything? We got the best health care system in the world with the best docs, the best drugs, the best medical procedures, and we're about ready to flush it with this bill. And what is this bill? What is this bill? Well, first of all, we're told it's only $950 billion. Less than $1 trillion over the next decade. Well, sure, right, exactly. It's got 10 years worth of revenue increases and 10 years worth of budget cuts in order to fund a program that doesn't begin for 4 years and is not fully ramped up for 7. And what is that program? Something new and different and exciting? No, it is a $434 billion federal expansion of the Medicaid system. Second-class health care. $434 billion. We don't begin spending it for 4 years, and it's not fully ramped up until 7 years, and we spend 81% of the Medicaid money between 2016 and 2019. And then remember all those rapacious insurance companies, those nasty, evil health insurance companies? The other program consists of $466 billion in subsidies to health insurance companies. That doesn't begin for 4 years and not fully ramped up for 7, and we spend 84% of the health care subsidy money between 2016 and 2019. And at the end of it, glory be, it's going to save us $143 billion on the deficit. It's that good a program. Well, let me ask you something. If it is so good and it's going to save us so much money, why are we waiting so long to start it? Why are we waiting 4 years? Look, you could ramp up. If the Medicaid expansion was going to save us money, we ought to ramp it up. What would it take, Governor? 6 months? 3 months to ramp up the rolls here? Why are we taking 7 years? Massachusetts got its health insurance exchanges going in about 12 to 14 months. Why are we taking 7 years? I'll tell you why. Because this program gets a running head start on creating a big pile of cash that it blows out in the back 4 years. And if you look at the first 10 years of the operation of this program, it's not $1 trillion, it's $2.6 trillion. They structured this program in order to hide the cost from the American people. This thing is unsustainable. It will absolutely drive our country into bankruptcy, and they know it, and they hid it from us, and they thought we were stupid, and we're not stupid. We just aren't. Oh yeah, though. They told us a lot of things. They told us a lot of things that made it sound good, though. They said, look, your premiums are going to be lower. We got to do something about these rapidly rising premiums. And then the Congressional Budget Office came out and said because of the new mandates that are being put on insurance and insurance programs and the new taxes, everybody in America will pay a tax on their insurance policy. And because of these new requirements in federal law, premiums will be higher than they would be otherwise. In fact, for the individual market, they'll be 10 to 13% higher than if we did nothing at all. Oh, then we were told, oh, you know what, we want to really, our real purpose is to bend the healthcare curve. We need to reduce the amount of money that's being spent on healthcare in America. And then they came out and said, well, guess what? Sorry, CBO says that we will spend $222 billion more on healthcare as a result of passing the bill than if we did nothing. Then we were told, oh, if you got what you like, don't worry, you can keep it. And then the CBO came out and said, oh, sorry, made a mistake. We think at least 9 million Americans will lose their coverage because we're going to make it so expensive that companies will dump the coverage and have to pay fines. Other groups, the Lewin Group, a respected health insurance group, said, no, you underestimated. It's going to be 19 million people. You know, we were told, oh, you know what? We just want to provide coverage, the same kind of coverage that members of Congress get. Well, if that's the case, why is our 16 million out of the 31 million people who are going to be covered by this covered by dumping into Medicaid?